Welcome to another podcast. Today, I'm sitting here with Jill Fitzpatrick, one of my very dear friends for probably close to 2 decades now, and we're going to be talking about travel medicine.
Yeah. So travel medicine is really fun. I love hearing from you guys where you're traveling to. I love doing it. It's really here to help protect you when you're traveling. So I use Travax to look up where you're traveling. It gives us the most up-to-date information on what's going on in that country. It will tell me what vaccines are recommended, if there's malaria there. So it's a great resource, and really the only resource I use to find this information out because it's up to date. And so I use that when you are traveling, and we'll have a consult. You can come into the office for it. We can do it over the phone. Some specific things that I really need to know when you're traveling is your time frame. If you're leaving fairly soon to the time of the consult, we need to get you in right away, talk about what we can get done before you leave. Some things won't be able to be accomplished if it's too close to time. So as soon as you find out you're traveling, call us. It's never too early. I love for vaccines, if you're going to get any for that trip, or if you need any, that they at least be done 2 weeks before you leave. But we can always talk about if that's not going to happen, risk and benefits of doing it right before. So we talk through all of that. So it's a really fun consult for me, and I love hearing from you when you come back and all the fun things you do, and just see how everything went.
Yes, I think that's really important, guys. So Jill does travel medicine on Thursdays only. So keep in mind she has a family and sometimes vacations. So if you can let us know if you book your trip and you book plane tickets, it's time to call us. So because we want to make sure you're taken care of well. We want to make it not rushed for you too. And then you get to go home with a cool travel pack, right? After your travel consult. Do you want to talk to them about what's in there?
So these travel packs are really fun. I think they're super useful. Inside of them, we'll have a paper information about all the medications that are in it and when you should take it and what for. The biggest thing in these, if you're traveling to an area that you are going to be more prone to traveler's diarrhea, we have the azithromycin in there for you. The rest of it is mostly over-the-counter medications, but I just love these packs because it's super easy to throw in your bag and take with you, and you have everything you need.
Yes. So Jill brought travel medicine to our practice, and it was an area we definitely needed. We love the service for patients. It saves you money. If you're not a patient, you can still do travel medicine. The other cool thing is too, is that this comes along with, we have our on-call. So if they have to use it, they can always pick up the on-call so we can say, yes, you're using it appropriately. If you have to use something, I still like getting a message saying, hey, I had to use, something out of my bag, just so I can keep tabs on that and check in with you when you come home. Yeah. So what do you need to know from patients exactly for travel?
Yeah, so when you call, I really need to know when you're traveling, your exact dates. And then the other thing that's really important is if you have layovers. Because depending on where your layover is, you may need vaccines for that layover if it's greater than 12 hours and it's in a certain part of the country. So really, when you're going and your layovers, if you're going to be doing any excursions, that's also helpful as well. So those are the main 3 things. Obviously, I ask you more questions than that, but when you call in, if you have those 3 pieces of information, that's super helpful. Also, when I say that, if you're traveling to several different areas and different flights, list all of those areas. Don't just say, oh, I'm traveling to India. Okay, well, are you have a layover somewhere? Are you going to be in lots of different parts of India? Are you staying in one area? So all that information, if you can give that to the ladies up front and they can get that in a message to me, I can easily pull everything and have it all prepared for you.
Okay. What are some red flags that can show a post-travel illness?
Yeah, so some things that I would get really concerned about, if you come back with a fever, we need to know. If you are having blood in your stool and abdominal pain or nausea or vomiting, that as well is a big red flag we need to know. I would say those are the 2 main things. But if you ever come back and you have any kind of symptoms, just do a shout out to us so we know what's going on. It could be as simple as just upper respiratory infection, or it could be more serious if you went to an area with malaria. You have to always remember, even though we treat you prophylactically with malaria, if you're going to those areas, you can still get it. So we would want to know if you're having any symptoms when you come back from travel.
Okay. What are your tips for staying healthy on the plane?
I would say support your immune system before you go. Obviously, some ways you can do that. You can come in and get a hydration bag or immune bag.
Immune bag.
So we can do that. Make sure you're taking your multivitamin. I really love Varicid. It's one of my favorite supplements for when you're not feeling great or you're concerned you're going to get sick. So those are my kind of go-tos. What about you, Brittany?
So Mike and I, my husband and I, we always come in and get an IV if we're going to be out of the country, because the way to get hydrated, start things out fresh. I like getting up, moving around, and still, even before we go, not going out in big groups to be exposed, because once we're there, we know there's a chance. And I think even taking Varicid 2 daily can help with that, support it. So hopefully you don't get sick. Also eating healthy, having less sugars, less carbs, getting good sleep, even if you're jet lagged, trying to get some sleep. And if that's something you're going to be dealing with, we can also treat that too.
Yeah.
So, any advice for travelers who get anxious about health issues when away from home?
Just remember that we're here to support you. So shoot us a message. We can always help guide you on if you need to go somewhere in that country and be seen, or if you don't need to. We obviously can't prescribe anything out of the country, but we can at least be there to help you through the situation and make sure you get the care that you need.
Sure. And if somebody's hesitant on vaccines, it's something we're going to educate you. We're going to tell you your risk versus benefits for them. But we also have things we can do to detox before and after you take vaccines for adults and for kiddos. That's something we can advise you on as well. What's something that's always in your travel bag?
I actually have my own little pack like this. It's very similar, but I have 3 girls, and so I adjust it to what we need. I actually even keep it in my car all the time. So I love the travel pack. So with that being said, when you guys get this travel pack, make sure you go through it. If there's stuff you know that you're going to use more of, or you think you'll use more of, like if you're going to use more Claritin or something, throw that in there, because these are just enough to get you by. So if there's something you think you would need more of, obviously throw more in there for you.
I love that. Zofran is a big one for me. I always make sure that I have extra Zofran just because of our kiddos. They get sick, traveling in the car, if they're reading in the car, so that car sickness. So Zofran's a big one for me. Rapid fire questions Esme's made for us. Thanks, Esme. Window seat or aisle seat?
Aisle.
And I'm a window. So Jill and I travel together, and it works really well for us. Sometimes we get stuck in the middle, of course, though, if we're with other friends. Yeah. Are you an early bird packer or last minute throw in the bag?
Early bird.
Me too. Early bird all the way.
Melissa,
she's buying stuff when she gets there. Or borrowing something from us. What's one travel item you can't live without?
I don't know.
Dry shampoo. Dry shampoo. I hate having to wash my hair on travel days, and so I think that's my big one to get me home.
That's a good one.
Probably because you're borrowing mine. The other thing to put in my bag, the SPF from Zio. I don't get burnt, so I constantly put that on. I also like the Zio powder too, because I put it in because I've got fair hair. I don't like my scalp getting burnt. What's one country on your bucket list?
Oh, I have so many.
I do too.
But I want to go to Switzerland.
Okay.
So
I'm thinking Ireland's on my list. There's a direct flight now. So guys, check it out. Well, thanks for joining us, Jill. That was a lot of fun as usual. And thanks for tuning in.